Good evening, everybody, and welcome to the Omega Revolution. My name is Debbie, and I'm here tonight with my co-host, Ray.
Hello.
And Ray, do you want to take care of some housekeeping before we get started?
Oh, yeah, this is just the typical, Zoom, Facebook rules. So we just ask that when the presentation starts, everybody mutes themselves in the beginning, or we will try to mute you if you're not. And then, of course, feel free to use the chat along the way if you have questions. Dr. Selmen is going to be opening this up for questions at the end. And we'll be monitoring questions here on Facebook as well as in the Zoom. So we're happy to ask those questions for you, or you can certainly go ahead and unmute yourself. And of course, this presentation is set up strictly for informational purposes, while Dr. Selmen is an extraordinary resource. And oh, hello, sweetheart. This information is not meant to treat or diagnose. So did I miss anything?
No, the only other one we normally cover is keeping your clothes on, and this is perfect. Hi, Donnie.
Donnie has no clothes on, so I apologize. Yeah,
absolutely. Awesome. I love that. So tonight we have Dr. Sharon Selmen joining us. Dr. Sharon holds a master's in clinical pharmacology and international clinical trials monitoring. She also holds international certificates for fitness and a health coach. She's also done work as a medical scientific liaison for diabetes and heart failure. And so tonight we are pleased to have Dr. Sharon present to us on the subject of diabetes prevention and maintenance. Thank you, Dr. Sharon.
Thank you, Ray and Deb, for having me here. It's my pleasure to be here with you with this very important topic about diabetes, to know who's at risk and what we can do to get a better management of the disease. I will share my screen. Okay. So first, let's get a reminder of what type 2 diabetes is. It's a disease in which your body cannot make enough insulin. Insulin is the hormone that will help control the amount of glucose or sugar in your blood, because it works as a transporter that will take all the glucose that is on your bloodstream and take them into the cells in order to have the energy that they require to function. When the insulin is not working properly, or we don't have enough, then type 2 diabetes is developed. It's caused by several different risk factors and affects 90% of diabetes cases in Canada. The most common symptoms and signs are excessive thirst, frequent urination, weight change. In here they can gain or lose weight, extreme fatigue or lack of energy, blurred vision, frequent or recurring infections, cuts and bruises that are slow to heal, and tingling or numbness in the hands or feet. Here it's very important to know that some persons may not notice any signs or symptoms. Type 2 diabetes can lead to a bunch of variety of complications that can affect your body from head to toe, including kidney disease, stroke, blindness, nerve damage, amputation, among others. People with diabetes are also at risk for mental health issues, such as anxiety or depression. This can be the result of the distress that comes along of the management of the disease. So what causes type 2 diabetes? As I mentioned before, it is caused by several different risk factors. And among these different risk factors, the important thing to know is what those factors can be controlled or managed or even modified, and which ones aren't. So you could be one of the 1.5 million Canadians who have diabetes and don't know. So it's important to know who's at risk and to get checked. Some of these risk factors are, first of all, having family history. And in this particular factor, it's mainly with a first degree relative. I mean, parents or siblings. There are high-risk populations that can increase our risk of living with type 2 diabetes. And I say our because I'm Hispanic. So African, Arab, Asian, Hispanic, South Asian, okay? Being more or older than 40 years old. These three factors, can you see that you can't modify them? Like you can't change how old are you? You can change if you are African or Hispanic, and you can't change your family history, okay? All other risk factors are high blood pressure, high levels of cholesterol or other fats in the blood, polycystic ovary syndrome. This is a hormonal disorder that is common among women of the reproductive age that will be characterized for high levels of the male hormones that are androgens that will be presenting in the body as facial hair and acne, and also with polycystic ovaries in some cases. Having high BMI as obese or overweight are risk factors, and essentially when this fat is around our tummy. If someone has the diagnosis of prediabetes, it's a huge risk factor for diabetes type 2. Psychiatric disorders such as schizophrenia, depression, bipolar disorder, obstructive sleep apnea. It's a disorder in which our breathing stops repeatedly during our sleep. That is followed by loud snoring, gasping, pauses. And this disorder is very important to be diagnosed because it can lead to high blood pressure, to stroke, or depression. And some of these patients are characterized by morning headaches as well. Another risk factor are darkened patches of skin that, if you can see the image in my slide, this is characterized by insulin resistance, and it's called acanthosis nigricans. Also, smoking and sedentary lifestyle. If you see, you can do something about some risk factors such as your body weight, if you smoke, and your physical activity, okay? Take care of your high blood pressure or your blood pressure. So, who has to be screened? If you don't have any of the risk factors that I commented previously, and you are younger than 40 years old, or has a low moderate risk in the CAN-RISC test. The CAN-RISC test is a test that is made for evaluating the risk for diabetes. It will ask things about your body shape, nutrition, the measurements in your waist circumferences, some data about your family history, okay? And depending on the results of this test, you can use it to know if you should be screened. So if we have, if the people are older than 40 years old or has a high risk marker in this CAN-RISC assessment, they have to be screened every 3 years. But if the person has a presence of the risk factor that I mentioned previously, or has a very high risk in the can risk test, then they should be screened every 6 to 12 months. Okay, this is not aiming to diagnose or treat. It's only for you to know who's at risk, and obviously you should go to your family doctor or to your doctor to evaluate your risk and to get checked. So there are two tests that can be used to screen. That is the fasting plasma glucose test, that if your result is between 6.1 and 6.3, it means that you have intolerance in the fasting glucose. If it's more or equal than 7 millimoles, you have the diagnosis of diabetes. And about the test A1C, this test is an average of the 3 months previous that you're doing your test of all your glucose levels. And a diagnosis of prediabetes will be with a result of 6 to 6.4%. And here I want to make a short comment about the American Diabetes Association, because they are a little bit more strict, and for them prediabetes it's starting at 5.7%. And the diagnosis of diabetes, it's done with an A1C of more or equal than 6.5. Gestational diabetes is a temporary condition that occurs during pregnancy. 3 to 20% of pregnant women will develop gestational diabetes, and obviously will depend on their risk factors. All pregnant women are screened between the 24 to 28 weeks. That's a common test they do among all pregnant women. But if they are at high risk, they will be screened earlier, before the 20 weeks marker. So, for having or presenting gestational diabetes, there are some extra risk factors. Obviously, if they have any of the previous risk factors that I commented before, if they are 35 years of age or older, if they have history of the use of corticosteroid medication, if they have gave birth to a baby that weighed more than 4 kilograms or 9 pounds, if they were overweight or had a BMI of obesity 3 kilograms per meter squared or higher before pregnancy, or if they already had a history of gestational diabetes in previous pregnancy or pregnancies. So you can manage better type 2 diabetes by eating healthy meals and snacks. You have to do regular physical activity. How much? You have to do 150 minutes of aerobic exercise. That means that you should do 30 minutes per day during 5 days per week. And in addition to this, that can be exercise such as running, walking in a pace that your heart rate can be a little bit elevated, swimming, bike. And you have to do also 2 to 3 times strength exercises for your muscles. You can do Pilates, yoga, or even with small weights, do some exercise or videos at home for strengthening your muscles. And monitoring your blood sugar with a home blood glucose meter is essential. You need to know that you are well controlled, that your medications are working, and you don't have like huge variability in your measurements. We have to aim for a healthy body weight. Okay, we have to opt and adopt a healthy lifestyle to to decrease our excess of body weight. Taking diabetes medications, if it's the case that you need insulin, and obviously everything should be prescribed by your doctor. Managing stress effectively it's very important because stress can intensify the symptoms, can affect your immune system, your sleeping, and if you don't want to go to a specific counselor or something like that, there's a lot of ways you can manage your stress. For example, you can do auto self-assessments for anxiety, depression. You can do some activities to manage that stress. It can be mindfulness or some type of meditations, breathing exercise, painting. I don't know. You have to check your feet daily. This is very important because, as I mentioned previously, they could be nerve damage. And if you have nerve damage, then you stop feeling. So you have to check your feet daily for sores, for redness, cuts, blisters. You have to use socks always with your shoes. You have to wash your feet daily, keep them dry, always use shoes, or I mean, don't be barefoot. It's recommended that you visit a nurse foot care for trimming your nails, because it's very important that there's no any sharp ends that could develop in a lesion or something like that. So there are some targets that as a person with the diagnosis of diabetes has to aim. And this is very important because with these targets, we are trying to diminish the risk of the complications. So the first target is the A. A is for A1C. So the target for this specific marker that, as I mentioned before, is the average of your 3 months previous of your glucose levels. So it should be below or equal at 7%. But if you want to decrease more the risk of kidney disease or retinopathy, you should be aiming to have less or equal than 6.5%. The target B is the parameter standing for blood pressure. We need to aim a blood pressure below 130/80. Okay? If you are on treatment, you should be assessed by someone, or you assess by yourself the risk of falls. How you do that? Keeping in mind if you're getting dizzy after taking the medication, if you are getting dizzy when you stand up from a sitting position or from a lying down position. If so, you need to talk with your physician, your family doctor, to check that the medication is working and your levels are okay and not way too down or way too high. The target C is for cholesterol targets, and in specific is the LDL, that you have to have less than 2 millimole per liter or 77 milligram per deciliter. Okay, so let's talk a little bit about healthy eating tips for diabetes. First of all, we need to understand that food is the key to managing diabetes and reducing the risk for the complications such as heart attack, stroke, and other problems. There are many things that you can do to change or improve your diet. And something that is very important, it's to avoid to try to change too many things at once. Start small and be consistent is the key. So we have to watch your portions. What I recommend always when we have already a diagnosis of diabetes or pre-diabetes is to be checked or assessed by a dietitian. Why? Because we need to know what is our requirement of calories, how much we need to eat, and to know what portions we need to eat of every food group. We need to eat healthy carbohydrates, and meaning whole grains. Beans has good and healthy carbohydrates, fruits. We need to eat more whole foods and less highly processed foods. Eat more vegetables and fruits because they have a lot of vitamins, minerals that our body needs to work correctly, and our cells need to function correctly as well. We need to limit sugars and sweets. We need to be consistent with your carbs. And by here I mean not starving one day without eating any kind of carbs, and the other day eating only pizza, pasta, and rice. Okay? Choose good fats. We need to get a good requirement of omega-3. Remember that omega-3 has to be get only via diet, so or via supplement. So it's important to have our daily requirement of omega-3 to have this help in the lowering blood glucose as fighting the chronic inflammation that this disease is characterized by. Avocado, nuts are also good fats. You need to drink water, at least 2 liters, okay, daily. And you need to plan ahead your meals. Planning ahead your meals will help you to be more organized, to buy what you need, and to have more adherence to this new lifestyle you're gonna have. So let's have 4 take-home messages. And number 1, you need to know who needs to be screened, who's at risk, and who needs to be screened. Number 2, do something about the risk factors that can be manageable. Number 3, if you already have the diagnosis of diabetes, meet the ABC targets in order to decrease the risk of having complications. And number 4, follow the healthy eating tips. Start small, be consistent. And very important thing, knowing is not enough. You must take action. Thank you very much.
Thank you so much, Dr. Sharon. That was very fascinating. I'm just going to stop the screen sharing here for a moment. And if we have any questions from the audience, and we'll check on Facebook as well. Ray, do you have any questions?
This was fantastic, actually. I had no idea some of the risk factors that you shared. So thank you very much. Yeah.
You're welcome, Ray.
Okay, so I do have one question so far. The long-term effects of peripheral neuropathy, and how could the balance oil help?
Okay. The long-term neuropathy, you're talking about the nerve damage. Okay, so there are articles and studies that talk about how omega-3 can help in the cartilage damage in the muscles, and also in the neuropathy ways in all the nerves. So I think that specifically balanced oil in terms of diabetes can help lowering the blood glucose, and it can lower it about 15%. That can help, but also fighting the chronic inflammation that is characterized like the chronic inflammation is what will be developing diabetes type 2 and all the complications that come with diabetes type 2. So my recommendation is to take the balanced oil as prevention or as part of your daily management and change of lifestyle to a healthy lifestyle for the management of type 2 diabetes to decrease the complications or to get better in those complications if you already have them.
Okay, thank you. Okay, we
We're
have
gonna
a question
unmute.
from Margot.
Yeah, I was just gonna unmute her. Oh, there she is. She's
Yep,
unmuted.
I've unmuted her.
Hey, thank you so much. Really, like Ray Lee has already said, great presentation. I appreciate your knowledge. I am curious, if during pregnancy a mother has gestational diabetes, what is the likelihood that it's going to carry on into type 2 for the rest of her life?
No, there's no risk. Like
No risk.
no, like you can be like very healthy and maybe you were overweight and you develop type 2 gestational diabetes, and then you won't be having type 2 diabetes. Like
Okay.
the likelihood is less to develop type 2 than other way around.
Okay. Can I ask 2 questions? Sorry. Oh,
Yeah,
can I-
absolutely.
That's
Can I-
2. So would you like to ask 3?
Yeah, right. Exactly. The other thing I'm wondering is, I'm kind of going back to the cell membrane or the balanced oil question, because my understanding is that, and I always get the EPA and DHA all backwards. So let's ignore that part. But if my cell membrane becomes softer, more malleable, and is able to pass toxins out and bring nutrients in, is that going to impact my insulin, like the ability for insulin to do what it's supposed to do with my cells?
Like it could work. Like there's no, like it's very difficult to have like clinical studies done, and we can talk about specific balance oil. We don't have right now like clinical studies that balance oil can do this in the cells of a diabetic person, you know. I can talk like in general perspective of what omega-3 can help,
Mhm.
and that the balance oil has polyphenols as well.
Yes.
So the polyphenols are antioxidants as well. So this antioxidant helps as a renal protector. So it also help in a way protecting your kidneys
Okay.
or your kidney cells. So if you ask me like if what can I, well, I can assure anything, but may be the thing that we can be expecting taking balance oil is that your cells will work better. Your insulin may be working better, the little insulin that you have, because your cells will be more flexible, okay, will be able to do better their job. And the help with the polyphenols will be an aid for your kidney cells as well.
Okay. Awesome. Thank you so much.
You're welcome.
Okay, so another question we have from Gail. Could cravings for sweets, especially during night, waking to have sweets, indicate the need for screening?
Maybe like not only like by itself, this sign, I will say go and get screened. Maybe I will have a chat with you and ask you more about it and see if there's another stuff going on. But if you know that you have some of the risk factors that I told previously and you have this craving for sweets, then maybe you should, because then maybe we can be talking about diabetes, or maybe you're having hypoglycemia during the night. So Maybe it's not like you are having high blood pressure, but maybe you are having low blood pressure. So
Okay, that's interesting because actually now that we were talking a little bit about that, that reminds me of one of the posts that we had this week in the Omega Revolution about the diabetic clock
yeah,
and where your body is at certain times of the day. And if I remember correctly, it said something about if you wake up in the middle of the night, it could be because you were low on protein or something like that. Maybe you can expand on that just a little bit.
yeah. You can be low, like it's common to have parts of the day that you will have hypoglycemia. That's the reason you need to be with a very close monitoring with your home glucometer, and to know that your meds are working and at what time are you taking those meds. It works different with type 1 diabetes that is more controlled, and it has to be with insulin uh, as treatment. But in this specific case, that if you have, Gail, any other risk factor, like only one, and you have these cravings, go and get checked, or even like only a prick with a glucometer to know when you're having this craving, what are your blood glucose, and check, because if you are low in blood glucose, you are not exempt or of not having diabetes. We have to check the overall with a test, a more deep test. In what I prefer is the A1C. It's more accurate because you are taking 3 months of your levels, not only one that you ate only vegetables the day before. Maybe your fasting plasma glucose will be great, but you can lie to the A1C.
Right. And so the second part of that question that Gail had as well, and you touched briefly on it, are all home glucose tests done by a finger prick?
The regular glucometers, yeah. There are a new freestyles devices that can go subcutaneous, but these are more for type 1 diabetes or
Yeah.
someone with type 2, but they have to be medicated with insulin. So
Okay.
in this
Yes,
case,
my cousin has one that he wears. He's type 1 diabetes, and he has one that he wears on his tummy, and I think it lasts for, I can't remember, I think it's probably 2 or 3 days or something like that. And I've had other people that I've known that wear the insulin pumps. There's different types, but like you said, that's more for the type 1 diabetes.
yeah.
Okay. Listening to you, and talking about the foods and how we should be eating and that, it sure makes me wonder why we've gotten away, and maybe we haven't, but it seems like the generations that are coming up, they're not being taught a lot of this in school, and they're eating so much unhealthy processed foods. They don't know, when I was in school, it was a few years ago, we had the home ec classes, and we had to learn how to cook. We had to do all these things. We did the food pyramids. I think they've probably changed a fair bit since then as well. But, we still had those bases of what's actually healthy. And I think, that's why we're getting kids nowadays that are getting sicker and sicker at a younger and younger age.
Yeah, I think that maybe we are in an era that we are living like in an automatic pilot, and we have lost the perspective of the prevention and how important it is to be healthy. I guess that after COVID and everything that it's happening to the world, we will be aiming, if we are not doing it already, to have a healthy lifestyle, because like now more than ever, if you don't have health, you don't have anything.
No. What are your feelings on the Mediterranean diet? In regards to diabetes or somebody that be pre-diabetic?
I think that it's a good option. the Mediterranean diet has a lot of studies that had shown improvement in several chronic diseases.
Mhm.
So it's a great option, high in good fats. It's not as heavy in the carbohydrates. And the carbohydrates are not bad. You only have to choose the good ones.
Mhm. Right. Okay, awesome. I'm just going to check social media here and see if we have any questions. We have a few people watching live. No questions there. Any other questions from the people that are joining us live in the Zoom? I don't want to monopolize and ask all the questions. So with the balance oil, I guess you would still do it by weight. You wouldn't maybe take a little bit more, a little bit less. You would just.
I'm very by the rules. So I'm a physician, so I would never be on top of the things that you should. So no, I would say that by the weight. Usually, if you have a type 2 diabetes, it's more common to be overweight or obese. So you will be taking more
Right.
than the regular dose. So
Right. Okay, good point. So Ray, you're off the hook when you just grab that bottle and you just chug her back and you don't measure. It's perfect.
Thank goodness.
So has everybody done, here's a question. Has everybody done their balance shot today?
no, I take it right now,
You take everything.
right before going to sleep.
Okay, awesome. Okay, well, if there's no other questions, we will close this out. We will be having Dr. Sharon back in the next few weeks. Sharon, we just changed a couple of those dates tonight. So I think the next date was August 19th?
No, August 28th.
August 28th, sorry.
And August 25 and 26.
Okay, so we'll obviously be reminding everybody, but we'll be having some customer presentations, and Dr. Sharon will be offering those again in English and Spanish. And we're super lucky to have her with us and her expertise in sharing her knowledge with all of us. So if there's nothing else, Ray, do you have anything?
No, just a reminder, if you'd like to view this presentation again, because I know there was some terrific information and sometimes I can't keep up with my notes, you can certainly find it also on our YouTube channel at the Omega Revolution. So you can find it there within the next 24 hours. So you can share it with your friends and family, and we hope to catch you next time. Thank you, Dr. Sharon.
Thank you.
Yes,
Thank
share,
you,
share,
everyone,
share. So
for being here.
thank you again, everybody. Take care. Have an amazing evening. Bye-bye.
Bye.